Good evening, my name is Dr.Johannes Dayrit. I'm from the Philippines. I am a dermatologist and I'm a dermatopathologist. I work in the university hospital as well as the government hospital. I'm a professor in the university and I am the clinical director of the laser center in the same hospital. I'm a faculty of the Star Asia Laser Surgeon Allies, which is based in Korea. I was also invited as faculty of the recently concluded Aesthetics 2017 in Delhi, and will be a faculty of Aesthetics Express in 2018. I've written book chapters on dermoscopy, on skin cancers. I also wrote 2 chapters in a recently published book, which is melasma and vitiligo in Asian skin. I wrote chapters on histopathology of melasma and histopathology of vitiligo. I also wrote a chapter on macular pigmentation of unknown etiology in an upcoming publication. I have several publications, mostly case reports and studies on facial hyperpigmentation. So this machine is one of the most versatile pigment lasers, which is both effective and safe for type 4 pigmented skin or Indian skin. It has a lot of indications to treat the various causes of facial hyperpigmentation and pigmented lesions. So this machine is very effective in treating all forms of pigmentation in Asian skin and also in Indian skin. It has also generated a very high satisfaction rate among patients, and most importantly, we see very little incidence of side effects like hypopigmentation or hyperpigmentation. So it's generally safe. So I'm talking about the tri-beam laser, which I've been using to treat Asian skin for the last 3 years. My recent journey in India, which is a part of the Tri-Beam Roadshow, which was an initiative of Skinnovation. I traveled to 4 different cities. I traveled to Delhi, Hyderabad, Bangalore, and Chennai, and I had a very amazing experience. So the topic of my talk or discussion is the various indications on the use of the Q-switched NDYAG laser in different forms of facial hyperpigmentation in Asian skin or in brown skin. I understand the challenges the Indian dermatologists usually face in their clinical practice. And it's very much like the same as in the Philippines because we're dealing with type 4 pigmented skin or brown skin. I also realized how important the tri-beam laser is in their practice. So in the panel discussions, I was able to share my experience with the tri-beam laser, and at the same time learned a lot from both the junior and the senior dermatologists who have used the tri-beam laser for quite some time already. So this Q-switched NDYAG laser is a very versatile pigment laser, which is very ideal for type 4 pigmented skin or Asian skin. So the most common indications for which I use the tri-beam laser in my clinical practice is number 1, laser toning for facial rejuvenation, I also use the carbon peel and the light peel for acne and for rosacea, and the usual indications in which I use the 532 nanometer wavelength for ephthalites, for lentigines, and then the 1064 nanometer for all the types of facial hyperpigmentation like nevus of Otta, acquired bilateral nevus of Otta like macules, melasma. I have also used it in some pathology conditions like hydroquinone-induced ochronosis or lichen planus and lichen planus pigmentosus. Well, my experience with the tri-beam laser as compared to the other pigment lasers, aside from being effective in the indications which I have mentioned earlier, it is also very safe in pigmented skin or brown skin, especially when I use the laser toning parameters. So that's low fluence in treating the most common conditions such as melasma and facial rejuvenation among my patients. The tri-beam laser, when you compare it with the other pigment lasers, it is not only effective, but it is very safe because it delivers the right amount of energy in a very uniform beam profile which targets specifically the chromophore and avoids damage to the surrounding uninvolved areas. So the reason for this is the top hat beam profile. That's number one. Number two is the PTP mode, or the photoacoustic toning pulse or twin pulse, and of course the Gaussian mode for better treatment of pigmented lesions. So I usually combine the tri-beam laser with the fractional CO2 laser, basically for facial rejuvenation and treatment of the more common pigmentary disorders like melasma. And I can do it on the same session or on alternate sessions. I can also combine it with the other procedures like chemical peels, platelet-rich plasma injections, and the other lasers for rejuvenation like intense pulse light. For laser toning, I use low fluence from 1.2 to 1.8, several passes, and I use it on a monthly basis. If the patients want a more immediate result, I can adjust the schedule to every 2 weeks. For the acquired bilateral nevus of Otta macules, I use 1064 nanometers. Start with the higher fluence, like 6.5 up to a level of 8 joules per centimeter squared. And then the endpoint is basically purpura, and repeat the procedure like monthly or every 2 months. So for the younger dermatologists, I advise you to be very precise about your diagnosis of facial hyperpigmentation before you start using the Q-switched NDYAG lasers. And it is best to settle with very good quality Q-switch NDYAG lasers like the tri-beam, because you will be able to deliver very good results to your patients. You'll be able to meet their expectations without having problems with side effects. I had a great time trying Indian food. I have always been a big fan of curry and Indian cuisine. Hyderabad's chicken biryani was like super. All the spices, all the flavors, I will always remember. So I enjoyed the naan, the different types of bread, the papad, the roti, all the chutneys and the curry, and of course the yogurt and the lassi. Yeah, they're all excellent. So basically I found Indian people, they're very hospitable, they're very kind. Even in the hotels, they are very courteous. I had a great time traveling with the Skinnovation people. They introduced me to the different kinds of Indian food. The idli, the chutney, and the sambal for breakfast is a very memorable experience. So I would like to thank Skinnovation for this great opportunity to share my knowledge to the Indian dermatologist. So I'm looking forward to coming back to India to experience this wonderful journey again. Thank you very much. Namaste.